So, good morning, everyone. First of all, we are so delighted to be with you here today and to teach you our topic, which is blood typing. So, first of all, we are from Southwestern University of Finma, taking up the course BSMLS or MedTech. We are currently second year students. So, I hope that since you're all incoming second year students as well for the next school year, I hope you'll be able to learn a thing or two from our discussion tonight. So first, let's have a short activity which is called song association. So I know that most of you here might know this game or icebreaker already. So the rules are simple. You just have to sing a song with the word displayed on the screen. So any kind of song, as long as you'll be able to mention the word presented on the screen. So okay, let's start. First word is love. So just sing a song with love on it. So I'm sure you're all singers. And now, after you've sang, answer this 4 picks 1 word game. So I'll be timing you guys 5, 4, 3, 2, 1. So the answer for this is correct. Most of you got it right. It is RBC. And now for the next word, we have baby. I know a lot of you guys know all the men below. Okay, very good. So now answer this once again. 5, 4, 3, 2, 1. So very good. This is anti. Okay, next we have boy. Okay, very good. Now, once again, answer this 4 picks 1 word. So this is quite hard. So 5, 4, 3, 2, 1. So I know some of you get challenged. So it is antibodies or antibody. Okay, so to properly start with our learning discussion, thank you so much everyone for your cooperation. We will start first with our learning objectives to be presented to us by Miss Asuke.
So here's some list of objectives why it is essential to study, learn, and execute blood typing in this modern age. First is to understand the ABO blood typing system. Students should be able to explain the basic principles of the ABO blood typing system, the presence of antigens and antibodies associated with each blood type. Identify blood typing methods and procedures. Learners should be able to describe the various laboratory techniques used to determine an individual's blood type, such as the agglutination reactions. Apply blood typing knowledge to real-world scenarios. Students should be able to analyze and interpret blood typing results in practical context, such as understanding the implications of blood compatibility and transfusion medicine.
Okay, so thank you, Miss Asuka. So I hope that by the end of this lesson, we will be able to achieve all these learning objectives. And now, before we formally start, let's have a quick fun facts to be presented to I by Miss Wong.
So before we start our discussion about the blood type, here are some fun facts about the blood type or the blood group's characteristics that each person in the blood type may carry. So for A positive, hardworking, A positive is good leadership. A negative, hardworking. So B negative, non-flexible, selfish, and sadistic. And then for B positive is selfless. So for the O negative, we have narrow-minded. O positive, born to be helped. And for the last is AB negative, sharp and intelligent. And for the AB positive, very difficult to understand. So in some settings, someone might ask, but some the personality traits are in but it's important to note this is more of a fun idea to explore rather than absolute markers of personality or individual identity. So next is we have the rarest blood type is also known as Rh null or golden blood type. The golden blood type or the Rh null group contains no Rh antigens in the red blood cells. This is the rarest blood type in the world, but less than 50 individuals having this blood group. The worry with this is that the donations are incredibly in short of supply and difficult to obtain. Across the globe, there are only 9 active donors for this blood group. This makes it the world's most precious blood type, hence the name golden blood. So next is the type O negative blood is preferred blood for accident victims and babies needing exchange transfusions. So the type O negative blood is the preferred type for accident victims and babies needing exchange transfusions, since type O blood is the universal blood type and is the only blood type that can be transferred to patients with other blood types. So there is always a need for type O donors because their blood may be transfused to a person of any blood type in an emergency. So the last is the percentage of the population with a certain type of blood. So for O positive, we have 37.4 as the most common blood type. Most patients require O plus positive. So A plus, A positive, B positive, this blood type is the good fit for platelet donation. So we have O negative, have 6.6%. This is the universal donor and critical needed as this can be transfused to any patient in an emergency. A negative have 6.3%. This can 6.3%. So next is we have AB positive have 3.4%. This is considered as the universal platelet donor, most needed for cancer patients. Next is we have B negative have 1.5%. And then lastly is the type AB negative, which have percent. This is most needed by newborns in crisis. So next is we have the
So next we'll have discussion will be about the principles of the different blood groups to be discussed to us by Miss Padilla and Mr. Calderon.
Okay, so this is the blood type A. The blood type A is where the individuals with A antigens in the red blood cells. Miss Padilla?
Contains antibodies that react specifically with A antigen present on the surface of red blood cells. The purpose is to use blood typing to determine whether an individual has an A antigen on the red blood cells. If coagulation clumping occurs when the blood is mixed with anti-A serum, it indicates type A blood.
Next is the blood type B. The blood type B is where those individuals with the B antigens on their red blood cells.
So, anti-B serum, which is yellow, contains antibodies that react specifically with the antigen present on the surface of red blood cells. The purpose used in blood typing is to determine whether an individual has the B antigen on the red blood cells. Coagulation when mixed with blood indicates blood type B.
Blood type O. Blood type O individuals have neither nor B A or B antigens on the red blood cells. They are the universal donors and can donate blood to individuals with any blood type.
So anti-sera RXN, since there is no antigen present in this type of blood, absence of coagulation clumping signifies type O blood, meaning there is no antigen antibody reaction.
The blood type AB. Blood type AB individuals has both A and B antigens on their red blood cells. They are the universal recipients and can receive blood types with a yes, in can receive blood types in from any individual's blood type.
So anti-Sera RX and again, since both antigens are present in this type of blood, aggregation clumping in both anti-A and B Sera signifies type AB blood. So to determine whether an individual has the Rh antigen on their red blood cells, aggregation when mixed with blood indicates Rh positive blood is H colorless. These sera are crucial components of blood typing tests, helping to identify the presence or absence of a specific antigen on the surface of red blood cells. This information is vital for blood transfusion as it ensures compatibility between the donor's and recipient's blood types, reducing the risk of adverse reactions such as hemolytic transfusion reaction.
So basically, to sum it all up, so our red blood cells contains the antigen, while the anti-sera, which is these in small bottles, they have the antibodies. So to easily understand, since we're all gonna be future medtechs, so to a quick hack for this is that the blue one is also termed as angel to indicate type A, and then the yellow one, which is same color with banana, so we call it banana to signify type B blood. And then the RH, the anti-D sera is colorless, so that will signify if the blood type is positive or negative. So when the blue clumps, it signifies type A. When the B sera clumps, it signifies type B. When there is no clumping in both type A and type B, it's type O blood. And when there is clumping in both type A and type B, this is type AB blood. So the same is true with the anti-D sera. When it clumps, it indicates positive, and if it doesn't, it is negative. So now let's talk about the importance of blood typing. Miss Asuke?
So, for the importance of blood typing, one of the best and most selfless reasons to know your blood type is to help others through blood donations. Knowing your blood type can help predict some conditions that can occur during pregnancy, such as Rh incompatibility between mom and baby. Blood typing helps you safely donate and help others, but it can also let you know if you are at risk for certain health conditions in the future. So for medical reasons, the most important reason to know your blood type is in case of an emergency. If you are in a situation where you require a blood transfusion, you'll need compatible blood. An incompatible blood group can cause blood cells to clump, which can be fatal. To help others, one of the best and most selfless reasons to know your blood type is to help others through blood donations. Medical facilities are always in need of blood donations, whether you are O or A. To plan healthy pregnancy, knowing your blood type can help predict some conditions that can occur during pregnancy, such as Rh incompatibility between the mother and the baby. To lower your risk for certain health conditions, most of the time, blood typing helps you safely donate and help others, but it can also let you know if you are at risk for certain health conditions in the future. Some studies suggest connections between certain blood types and risk of blood clots and bleeding and kidney stones.
Okay, so thank you so much for that, Miss Asuke. And now the last part of our discussion is assessment. So we will be testing you how to read the different blood types as presented in our anti-sera antigen reaction. So the first one is, can anyone answer what the blood type is for this slide? 5, 4, 3, 2, 1. So since there is no clumping in both the anti-A and anti-B, so this is O positive. Since the anti-D, we can see some agglutination. Now, next for this slide, 5, 4, 3, 2, 1. So this is type B, negative, since we can only see the banana anti-sera with clumps on it. Next, how about this slide? 5, 4, 3, 2, 1. So for this slide, all anti-sera has clumps. So this is type AB positive. So now this one. 5, 4, 3, 2, 1. So this is type A positive blood type. So that would be all for our discussion about blood typing today rather. So I hope you've learned a few things from us. This is just a surface discussion of the blood typing topic. So a lot more goes into it, but this is a good start to have your understanding or foundation regarding blood typing as future medtech. So thank you so much for your presence today, and thank you for your time, and we hope to see you on the next time. So thank you, everyone.